Let's talk about what are the early signs of type 2 diabetes. Understanding type 2 diabetes. Type 2 diabetes is a chronic condition that affects how your body processes blood sugar. It occurs when your body becomes resistant to insulin, which is a hormone made by the pancreas that helps glucose enter cells for energy. Some early signs of type 2 diabetes include increased thirst, frequent urination, blurred vision, and fatigue. One of the most common symptoms of type 2 diabetes is elevated blood sugar levels. This can cause increased hunger and cravings for sugary or high-carbohydrate foods. Additionally, weight gain or difficulty losing weight can be indicative of insulin resistance and onset of type 2 diabetes. It's important to note that some individuals may experience no symptoms at all in the early stages of type 2 diabetes. Therefore, it's recommended to get regular checkups with your healthcare provider and monitor blood sugar levels if you have risk factors such as obesity, family history, or sedentary lifestyle. Early detection and management can prevent long-term complications such as nerve damage or cardiovascular disease associated with uncontrolled high blood sugar levels in type 2 diabetes patients. Increased thirst and hunger. One of the early signs of type 2 diabetes is increased thirst and hunger. This occurs because high blood sugar levels make it difficult for the body to absorb glucose. The cells in your body depend on glucose for energy, so when they don't get enough, you feel hungry and crave food. Additionally, as the kidneys try to flush out excess glucose from the bloodstream, you may feel more thirsty than usual. If you experience these symptoms frequently or consistently, it's important to speak with your healthcare provider. They can perform tests to determine if you have diabetes or another condition that might be causing your symptoms. Early detection and treatment are key to managing diabetes effectively and preventing complications down the road. In addition to increased thirst and hunger, other early signs of type 2 diabetes include frequent urination, especially at night, fatigue, blurred vision, slow-healing cuts or bruises, tingling or numbness in hands or feet, and recurrent infections such as yeast infections or urinary tract infections. If you notice any of these symptoms in yourself or a loved one, seek medical attention right away. Early warning signs. One of the earliest warning signs of type 2 diabetes is frequent urination. When your blood sugar levels are high, your kidneys try to filter and eliminate the excess glucose from your body through urine. This can result in you feeling like you need to use the restroom more often than usual. Another warning sign is increased thirst or dehydration. As a result of frequent urination, you may become dehydrated and feel the need to drink more fluids than normal. However, it's important to avoid sugary drinks as they can exacerbate symptoms. Fatigue and irritability can also be early warning signs of type 2 diabetes. When your body's cells don't get enough glucose, you may feel tired and lack energy throughout the day. Additionally, if your blood sugar levels fluctuate frequently due to insulin resistance, it can impact your mood, resulting in irritability or feelings of anxiety. Frequent urination. Frequent urination can be an early sign of type 2 diabetes. This occurs because high blood sugar levels in the body cause excess glucose to be filtered out by the kidneys and excreted through urine, leading to increased frequency of urination. In addition to frequent urination, other symptoms of type 2 diabetes may include fatigue, blurred vision, slow healing of wounds, and increased thirst and hunger. It is important to note that not everyone who experiences frequent urination has diabetes. Other potential causes could include a urinary tract infection or an enlarged prostate gland in men. However, if you are experiencing this symptom along with other signs of type 2 diabetes or have a family history of the disease, it is recommended that you speak with a healthcare professional for further evaluation and testing. If left untreated, type 2 diabetes can lead to serious health complications such as heart disease, nerve damage, kidney damage, and blindness. Early detection and management are key in preventing these complications and ensuring good overall health. An indicator of diabetes. One of the most common indicators of type 2 diabetes is increased thirst. This happens because high blood sugar levels can cause dehydration, leading to a constant feeling of being thirsty. If you notice that you are consuming more fluids than usual and still feel dehydrated, it could be a sign of diabetes. Another early symptom is frequent urination. High blood sugar levels can cause an increase in urine production, leading to frequent trips to the bathroom. This can also lead to dehydration, as mentioned before. If you find yourself needing to use the restroom more often than usual, or wake up multiple times during the night to urinate, it may be worth checking with your doctor for diabetes screening. Lastly, blurred vision can also be an indicator of type 2 diabetes. High glucose levels in the blood can affect fluid balance in the eyes and lead to swelling in the lenses. This causes changes in vision and may make objects appear blurry or distorted. It's important to remember that these symptoms may not necessarily indicate diabetes on their own, but if they persist over time or occur together, it's best to consult a healthcare professional for further evaluation and potential diagnosis. Unexplained weight loss. Unexplained weight loss can be an early sign of type 2 diabetes. This is because in people with this condition, the body cannot properly use insulin, a hormone that regulates blood sugar levels and helps move glucose into cells to provide energy. As a result, the body may begin breaking down fat and muscle tissue for energy instead of using glucose from food. Unexplained weight loss can be an early sign of type 2 diabetes. This is because in people with this condition, the body cannot properly use insulin, a hormone that regulates blood sugar levels and helps move glucose into cells to provide energy. As a result, the body may begin breaking down fat and muscle tissue for energy instead of using glucose from food. Often called metabolic syndrome. This commonly refers to a combination of obesity, high blood pressure, high blood sugar levels, and low HDL cholesterol. If you are experiencing unexplained weight loss or other potential signs of type 2 diabetes, it is important to speak with your healthcare provider for proper diagnosis and treatment. Early detection and management can help prevent complications associated with high blood sugar levels such as heart disease, nerve damage, kidney damage, and vision problems. A sign to look out for. One of the most common early signs of type 2 diabetes is increased thirst or frequent urination. This happens because when blood sugar levels are high, the kidneys have to work harder to filter out excess glucose from your body. As a result, you may feel dehydrated and thirsty more often than usual, leading you to drink more water and urinate frequently. Another sign to look out for is fatigue or weakness. When your cells don't get enough glucose due to insulin resistance, they're unable to produce energy efficiently. This can make you feel tired and weak even after getting enough rest. If you notice any of these signs, it's important not to ignore them and seek medical attention right away. Early detection and management of type 2 diabetes can prevent further complications and help manage symptoms effectively. Fatigue and irritability. Fatigue and irritability are two of the most common early signs of type 2 diabetes. When blood sugar levels are too high, your body has a hard time converting glucose into energy, which can lead to feelings of fatigue and lethargy. This often leads to decreased productivity at work or school, as well as difficulty completing everyday tasks. In addition to fatigue, irritability is another sign that your blood sugar levels may be off balance. When glucose cannot enter cells properly due to insulin resistance or other factors, it can build up in the bloodstream and cause mood swings and irritability. This can make it difficult to maintain healthy relationships with friends and family members. If you are experiencing symptoms like fatigue and irritability on a regular basis, it is important to talk with your healthcare provider about getting tested for type 2 diabetes. Early detection can help you get the treatment you need to manage your condition effectively and avoid more serious health complications down the line. Symptoms of high blood sugar. Increased thirst, frequent urination, and fatigue are some of the most common symptoms of high blood sugar levels. These symptoms are usually the first signs that an individual may develop type 2 diabetes. When blood sugar levels rise to dangerous levels, it can lead to blurry vision, headaches, and even weight loss. If left untreated for an extended period of time, high blood sugar levels can cause damage to vital organs such as the kidneys and heart. Additionally, individuals with high blood sugar may experience nerve damage in their feet or hands. It is important to seek medical attention immediately if experiencing any of these symptoms or suspecting high blood sugar levels, as early detection and treatment can prevent further complications. Blurred vision. Blurred vision is one of the early signs of type 2 diabetes. High blood sugar levels can cause swelling in the lenses of your eyes, leading to blurry vision. This is a common symptom in people who have undiagnosed or poorly managed diabetes. Blurry vision can occur at any time, but it may be more noticeable after eating sugary foods or drinking sweet beverages. If left untreated, high blood sugar levels can damage the small blood vessels in your eyes and lead to diabetic retinopathy. This condition can cause permanent blindness if left unchecked. It's important to get regular eye exams if you have type 2 diabetes so that any potential issues can be caught early and treated. In addition to blurred vision, other early signs of type 2 diabetes include increased thirst, frequent urination, fatigue, and slow healing wounds. If you're experiencing any of these symptoms, it's important to see a doctor right away for a proper diagnosis and treatment plan. Lifestyle changes such as diet modification, exercise, and medication management could help manage the condition effectively. A complication of diabetes. One of the most common complications of type 2 diabetes is neuropathy, which is nerve damage that can cause numbness, tingling, and pain in the hands and feet. This complication occurs over time as high levels of glucose in the blood gradually damage small blood vessels that supply nerves with oxygen and nutrients. Early signs of neuropathy include a loss of sensitivity to touch or temperature changes, particularly in the feet. Another serious complication associated with diabetes is cardiovascular disease. People with diabetes have an increased risk for heart attacks, strokes, and other cardiovascular problems due to high levels of glucose in their bloodstream damaging arteries over time. Some early warning signs include chest pain or discomfort during physical activity or emotional stress. Finally, diabetic retinopathy is another common complication that affects the eyesight of people with diabetes. High levels of glucose can damage blood vessels leading to retina, the light-sensitive tissue at the back of your eye, causing blurred vision or even blindness if left untreated. Regular eye exams are essential for detecting early signs of diabetic retinopathy before it becomes too advanced to treat effectively. Conclusion. In conclusion, recognizing the early signs of type 2 diabetes is crucial for managing the disease and preventing complications. Symptoms such as increased thirst, frequent urination, fatigue, blurred vision, and slow healing of wounds should not be ignored. It is important to get regular checkups with a healthcare provider to monitor blood sugar levels and catch any potential problems early. Additionally, it is essential to maintain a healthy lifestyle through diet and exercise. Eating a balanced diet rich in whole grains, fruits, vegetables, lean proteins, and healthy fats can help manage blood sugar levels. Regular physical activity can also improve insulin sensitivity and aid in controlling diabetes. Overall, early detection of type 2 diabetes combined with proper management through lifestyle changes and medical treatment can lead to better health outcomes and prevent serious complications down the road. Seek medical advice early. Early signs of type 2 diabetes can be subtle and easily overlooked. They include frequent urination, increased thirst, fatigue, blurred vision, and slow healing of cuts or bruises. If left untreated, these symptoms can progress to more serious complications such as nerve damage, kidney damage, and heart disease. It is important to seek medical advice early if you suspect that you may have type 2 diabetes. A simple blood test can confirm whether or not you have the condition, and your doctor can provide guidance on how to manage it effectively through changes in diet and exercise or medication if necessary. Delaying medical attention for type 2 diabetes can lead to serious consequences such as blindness, amputation due to nerve damage, stroke, or heart attack. Seeking medical intervention at an early stage helps prevent complications while ensuring that those with the condition live a healthy life.